So it's my pleasure to present these results on behalf of the investigators EV201 enfortumab vedotin monotherapy for locally advanced or metastatic urothelial cancer in patients previously treated with platinum and immune checkpoint inhibitors. So we know that about 18,000 patients will die of urothelial cancer that will consist of cancers of the upper urinary tract, renal pelvis, bladder, and ureter. First-line therapy for most patients remains platinum-based chemotherapy. However, nearly all patients will progress after and receive subsequent treatment. Second-line therapy that is approved by the FDA includes one of 5 checkpoint inhibitors. Unfortunately, the response rates for these checkpoint inhibitors are anywhere between 13 and 21%, and most patients will require further therapy due to progressive disease. Unfortunately, there is no standard therapy for patients who have progressed after platinum-based chemotherapy or a PD-1 or a PD-L1 inhibitor. Enfortumab vedotin is an antibody-drug complex that targets Nectin-4, and this is a therapeutic target that's expressed in multiple solid tumors and expressed at low levels in normal tissue, and it's expressed at a high level in urothelial cancers. So this diagram explains the process or the action of enfortumab vedotin. This is a monoclonal antibody that's linked to an antitubulin agent called MMAE. This recognizes Nectin-4 on the bladder cancer cell. It's internalized, the lysosome cleaves that complex, and then the antitubulin agent hits tubulin and causes cell death and cancer death. So the EV201 trial is a 2-cohort study. This morning I'll be presenting cohort 1, which as I mentioned before, the previously treated patients with platinum or checkpoint inhibitors. Cohort 2 is ongoing, and this includes patients who are ineligible to receive platinum and have had a prior PD-L1 inhibitor. The drug is administered at 1.25 milligrams per kilogram on days 1, 8, and 15. Our primary endpoint was objective response as measured by a central review committee. Duration of response, progression-free survival, overall survival, and safety were our secondary endpoints. This is a representative population of this type of patient with urothelial carcinoma. The median, predominantly male, median age of 69, ECOG performance status 85% or 68% being 1. Poor prognostic factors are seen in about half of patients. 90% of patients had disease in the viscera, and 40% of patients had disease in the liver. And if we look at the PD-L1 staining, it's about 35%, which is what you would expect for this population of patients. These are our response rates. 44% of patients had a confirmed objective response, with 12% of patients demonstrating a complete response. In an area that's very, very difficult to treat, metastases to the liver, we had a 38% response rate. And when we look at all different subgroups, the confidence limits overlapped, showing that there was no one group that seemed to benefit more than the other. When we perform the waterfall plots, we see that 84% of patients had some form of tumor shrinkage. And when we look at the various progression of Kaplan-Meier curves, including duration of response, the median is 7.6 months, progression-free survival 5.8 months, and then also the overall survival is 11.7 months. The lower limit for the confidence levels is 9.1 months, and we have not reached the upper limit at this particular point. The drug was well tolerated. The majority of side effects were grade 1 and grade 2. These included fatigue, alopecia, decreased appetite, dyskinesia, peripheral sensory neuropathy. Overall, about 12% of patients were discontinued treatment due to toxicities. And the most commonly encountered grade 3 or higher side effect was neutropenia. So in conclusion, there's a high unmet need for patients with advanced metastatic urothelial cancer. Enfortumab vedotin is the first novel therapeutic agent to demonstrate substantial clinical activity in patients who progressed after platinum chemotherapy or a PD-1 or a PD-L1 inhibitor. We had a 44% objective response rate and a 7.6-month median duration of response. We saw responses across all subgroup of patients, and this was irrespective of their previous response to PD-L1 inhibitors. And again, we had a high level of response in liver, 38%, and that confirmed our observations in the phase 1 trial. It was tolerable with a manageable safety profile, and as I mentioned before, these results were similar to our phase 1 experience, and we feel that both of these trials support the submission to the FDA for accelerated approval. There is a large randomized trial that is now ongoing in the same patient population that we're presenting this morning, comparing enfortumab vedotin to dealer's choice chemotherapy, and that will be our pivotal phase 3 trial with this particular drug. We're also looking at various combinations. So we're very, very excited about this data this morning. Thank you.